Hi again. Welcome to Pearl Magazine. A promise by state and Hong Kong leaders that horse racing and dancing to go on as before was the repeated assurance offered by top officials that life would continue as usual after the handover in 1997. But few could have predicted what would unfold over the next 25 years. Frightful epidemics, a healthcare system pushed to the brink, dreams of home ownership that would remain just a dream for many, and a troubling wealth gap that grew larger than ever. Just a few of the several crises that were to come. On July 1st, 1997, Hong Kong reverted back to Chinese rule. Soon after the handover, Hong Kong was met with a public health crisis.
呢次嘅禽流感對香港嘅市民咧帶嚟好大嘅困擾，同埋好大嘅不安，做咗最後決定，要殺咗所有香港嘅雞。
In 1997, the first cases of human infection by the H5N1 virus in the world were found in Hong Kong. 6 people died. Wet markets were disinfected and live chicken imports from the mainland were halted. 1.3 million live chickens were eventually culled in Hong Kong.
根治禽流感病毒，保障全港市民健康。
It was the first time that humans were infected by this strain of the avian flu virus in the world. Moreover, the H5N1 avian flu had a relatively high death rate. I remember that out of 18 of our patients, the death rate was about 1/3. That's why the outbreak not only caused widespread concern in Hong Kong, but also around the world. In Hong Kong, for the sake of suppressing this outbreak, we had to resort to a chicken cull.
Hong Kong saw repeated outbreaks of avian flu afterwards. Every time, the government chose to respond by culling more chickens. 2006, a ban was announced on backyard poultry raising.
We made this decision then. Looking back, it was necessary to do it. However, in the past, we seldom used such extreme measures to deal with diseases transmitted from animals to humans. So there would naturally be different views about it.
The Asian financial crisis in 1997 left the government in a tight spot. The University Grants Committee decided to cut the number of medical training places from the 2001-2002 academic year, eventually reducing it from 330 to 280 a year.
They simply cut the medical training places. After this went on for more than a decade, it was partly to blame for the current shortage of healthcare staff now. We seem to be following the Western idea that if you invest so much in the public healthcare system, it would place a long-term heavy burden on the government. For me, the most important thing is people's lives, safety, and health.
In 2000, the consultation document on healthcare reform published by the Health and Welfare Bureau proposed developing primary healthcare, making better use of the private healthcare system, and developing Chinese medicine. The first Chinese medicine hospital in Hong Kong is expected to be completed in 2025.
In April 2003, during the peak of SARS, the then chief executive, Mr. Tung, sent me to visit Guangzhou with representatives of the health department. The reason was that in late 2002, Guangzhou might have had a SARS outbreak. At the time, they had treated SARS by combining Chinese and Western medicine in Guangzhou and achieved some results. When I returned, I immediately requested the National Administration of Traditional Chinese Medicine to send Chinese medicine practitioners to Hong Kong to participate in the treatment of SARS.
In March 2003, Hong Kong was hit with the SARS outbreak. It started with a super spreader checking in to the Metropole Hotel. Later, several people in a ward at Prince of Wales Hospital were infected. Soon, the virus had spread to the community. In late March, a major outbreak at Amoy Gardens infected more than 300 people. During the 5 months of the SARS outbreak, a total of 1,755 people were infected. 299 people died, including 6 medical staff from public hospitals.
SARS was highly infectious, but one of the characteristics of its transmission was it was very unpredictable. While many close contacts might not catch the virus, those with no contact history got infected. This unpredictability caused a lot of fear. In general, the symptoms were much worse than COVID-19. In Hong Kong, the death rate was over 10%.
After the SARS outbreak, the government, the hospital authority, and the Legislative Council set up committees to investigate the incident. Eventually, the Secretary for Health, Welfare and Food and the chairman of the hospital authority, among others, resigned in 2004.
我必須強調大家唔需要恐慌，就要爭取人類豬流感喺香港擴散之前，將呢病毒有效咁控制。
After the SARS epidemic subsided, Hong Kong saw its first case of human swine flu involving the H1N1 virus in 2009. Patient 0 was an airline passenger arriving in Hong Kong from Mexico via Shanghai. That year, there were more than 30,000 confirmed cases.
自願醫保計劃，政府會喺今年稍後就具體落實方案諮詢公眾。
After years of discussion, public consultation on the VHIS was launched in 2014. One of the greatest controversies was whether to allow people with severe illnesses to join. In the end, the relevant provisions were excluded from the scheme. The scheme was implemented in 2019. Policyholders were entitled to claim tax deductions of up to $8,000 a year.
政府同埋醫管局已經共同制定整體醫院發展計劃，喺未來10年將動用2000億元落實有關嘅發展項目。
In a bid to meet growing demand for public hospitals, the government came up with the first 10-year blueprint for hospital development in 2016. By redeveloping public hospitals, updating facilities, and building a new hospital in the Kai Tak development area, it was supposed to add 6,000 beds by 2026.
醫院管理局建議實施緊急級別措施，所有公立醫院謝絕探訪。
17 years after SARS, the COVID-19 virus started spreading. With multiple cluster infections, several districts were hard hit. The healthcare system was soon under siege.
I think in Hong Kong we've learned a lot of lessons from SARS. Our healthcare system has made many improvements, including the Infectious Disease Center at Princess Margaret Hospital, and more than 1,000 negative pressure isolation wards distributed throughout Hong Kong. These facilities were already in place at the start of the COVID-19 outbreak.
Amid the fifth wave of the epidemic at the start of this year, the number of confirmed cases exploded. Several public hospitals were overwhelmed and patients were treated in tents outdoors. Elderly care homes were repeatedly hit with outbreaks.
Before the fifth wave, apart from loopholes in our measures against importation of cases, which led to some small and medium outbreaks in the community, we failed to adopt more extreme or stringent measures to lock down restricted areas. This gave an opportunity for the virus to cause a major outbreak in Hong Kong, like in Western society. This is because you don't have the capacity of a national healthcare system to take in tens of thousands of patients within a short time.
At the height of the epidemic, apart from sending medical teams, the central government helped to build temporary treatment facilities. Hong Kong has now suffered with COVID-19 for more than 2 years, exacerbated by a shortage of healthcare workers. In 2016, in an effort to tackle the chronic shortage of public hospital doctors, the Legislative Council scrutinized the Medical Registration Amendment Bill. However, the medical sector opposed it on the grounds that non-locally trained doctors might not meet the necessary standards. Last year, the Food and Health Bureau published the Healthcare Manpower Projection, projecting a shortage of more than 1,600 doctors by 2030 and a shortage of almost 2,000 doctors by 2040. The Legislative Council finally passed the Medical Registration Amendment Bill, allowing non-locally trained doctors with recognized medical qualifications to register without taking the licensing examination after working in Hong Kong for 5 years.
Whether there is a shortage of healthcare workers or not is not down to one single reason. The reasons include how balanced our training is, whether the public system has adopted effective measures to attract and retain staff, and how we strike a balance between the public and private sector. It's kind of like a roller coaster ride. There was a time when I thought our healthcare reforms were really good. However, faced with a different challenge, we will adjust our mindset and accept some criticisms about our inadequacies, as well as continue to sum up experience and make improvements in order to live up to the people's expectations.
25 years after the handover, Hong Kong continues to live under the shadow of epidemics. During this time, workers have been especially hard hit, trying to make ends meet. Have their labor rights been adequately protected? When we come back, government security blankets in tumultuous times. Stay with us. Welcome back. The Asian financial crisis and subsequent global economic downturn hit Hong Kong hard in the years following the handover. Scores of businesses, from retail to F&B to hospitality, have been forced to close, fueling massive layoffs and soaring jobless rates. To shore up Social Security, the government launched various welfare plans and financial policies, including the mandatory Provident Fund scheme. But in the face of deep-seated societal problems, have they achieved meaningful results? Soon after the 1997 handover, Hong Kong was hit by the Asian financial crisis and the stock market crashed. Several organizations, including Hutchison Telecom and Modern Terminals, announced layoffs, and the Japanese department store Yao Han was liquidated. The unemployment rate soared.
After the handover, there were changes in the economic environment and structural changes. Facing these changes, workers experienced hardships and had difficulties finding a job. The result was strong capitalists and weak labor. We had no bargaining power. Very often, we had to rely on the government for help.
香港超過70%嘅小企業嘅僱主，佢都認同強積金係僱員應有嘅權益。
During every economic downturn, lower-income employees are the most impacted. If they stop working, they can lose their livelihoods. In 2000, Hong Kong implemented the mandatory Provident Fund system. All employees and self-employed persons from 18 to 65 are required to join an MPF scheme. Employers and employees are both required to contribute to a fund. Generally speaking, employees may only withdraw their MPF upon reaching 65, except under certain circumstances.
When it was passed, do you know what was said in the debate? I said this was a rotten orange, but it was better than none. I said it was a somewhat rotten orange because I was concerned about many things such as funding. What if the fund management fees are high? It turns out that they are really high.
In 2012, the MPF implemented the Employee Choice Arrangement, allowing employees to transfer the MPF derived from their contributions to an MPF scheme of their own choice once a year. However, the MPF derived from the employer's mandatory contributions could not be transferred.
我哋做一個深入嘅檢討，我應該有一個有效嘅退休保障計劃。
The MPF was criticized for not adequately providing for retirement in old age. People began demanding universal retirement protection. 2013, Carrie Lam, then the chief secretary and head of the Commission on Poverty, commissioned a study from Professor Nelson Chow. In 2014, the research report on the future development of retirement protection in Hong Kong proposed setting up universal old age pension. Public consultations sparked fierce debate.
Carrie Lam later dropped this study. I was really angry at the time. If you don't do it today, what will happen to the elderly in the future? The community has to take care of the elderly. This is saving for a rainy day for the whole society.
強積金對沖係另一個長期困擾勞工嘅議題。本屆政府對取消對沖安排嘅立場係明確嘅。
The controversial MPF offsetting mechanism was also under fire. When CY Leung ran for CE in 2012, he promised to gradually reduce the offsetting ratio. In Carrie Lam's 2017 CE policy address, she proposed scrapping the offsetting mechanism. In June this year, the Legislative Council finally passed the Offsetting Arrangement Amendment Bill to abolish it. But it won't be implemented until at least 2025.
I want to say this to the industrial and business sector. If you have already offset several billion and still want to offset more, how are the poor workers going to retire? Employers and employees both make 50% contributions to MPF, and the government doesn't contribute anything. But the retirement system we're talking about requires contributions from the government. We've talked about it for so long. Of course, the one thing I want most is CPF, the Central Provident Fund.
Various industrial actions in Hong Kong over the years have aimed for better pay, among other improvements.
When workers are extremely unhappy, they will vent their feelings in an industrial action. That's why when I talk to the government, whether during the time I was a legislator or otherwise, I'll tell them if they refuse to handle the conflicts over a long period, it'll end in a showdown. It's only a matter of time.
制定法定最低工資係我任內提出嘅重要嘅勞工政策，目的就係保障基層嘅勞工。
In May 2011, the Minimum Wage Ordinance was implemented. The first statutory minimum wage rate was $28 per hour. This is reviewed twice a year. When the SMW rate was frozen in 2021, it was maintained at the 2019 level of $37.50 per hour.
It's characteristic. On the question of minimum wage, we were surprised that Donald Tsang, who is a believer in the free market economy, accepted our proposal. Of course, he wanted our votes, but it was also characteristic of him. He knew that he had to take responsibility if these hundreds of thousands of low-income labor and poor workers became a problem later on. You'd have to spend a lot on comprehensive Social Security assistance. I was quite happy about this business.
after the Labor Department released the report of the Policy Study on Standard Working Hours in 2012, the government set up the Standard Working Hours Committee to explore the feasibility of setting standard working hours in Hong Kong. Its report in 2017 recommended contractual working hours in which employers would enter into contracts with employees, stipulating the daily or weekly working hours.
I'm most unhappy about the standard working hours because it could not be accomplished. People said, Ms. Chan, they don't even have a job. What's the use fighting for standard working hours? I said, it's not a choice between a job and fighting for standard working hours. That's not it. It needs to be done. I don't mind working longer hours, but you have to compensate me. I demand double pay. You can't just make me work overtime. We need to give people a choice. I still feel bad about this. It's something I wanted to achieve very much.
25 years after the handover, there have been a few improvements in labor welfare. At the beginning of 2019, paternity leave was finally increased from 3 to 5 days. At the end of 2020, statutory maternity leave was increased from 10 to 14 weeks. Starting this year, the statutory holidays, commonly known as labor holidays, will be increased from 12 to 17 days in stages, with a new holiday added every 2 years to gradually align with general holidays. In 2013, government officials set the official poverty level at 50% of the median monthly household income in Hong Kong before policy intervention. By 2020, the number of people in poverty in Hong Kong had soared to a record high.
I want to stress one thing. Don't try to lower the poverty line by taking into account some welfare, such as rent assistance. You have to look at the primitive data without considering other things. You should take action by following this direction. Try to think of ways to help them. What's the percentage of the poor population? What's their composition? What's their age distribution? What else can you do to help?
The Old Age Living Allowance was introduced in 2013. At $2,200 a month, it was twice as much as the Old Age Allowance, also known as fruit money. In 2018, the government introduced higher OALA, which was nearly 30% higher than normal OALA.
我哋今日正式推出香港年金計劃，為退休嘅長者提供多一個退休嘅理財選擇。
The same year, the HKMC annuity plan for Hong Kong permanent residents aged 65 years and older was implemented. Reverse mortgage programs were already available. Later, in 2019, the policy reverse mortgage program was introduced.
That's why some people said to me, Ms. Chan, actually, it's not that bad. There's something for everyone. I said it's not enough to live on. If they're poor, how could they apply for the reverse mortgage program? If they don't have the money, they have to rely on government support again. I always say that people need to have some money to spend so they can retire with dignity. If not, they will have to live on CSSA. I think the new government must show resolve. The best way to help poor people is not to give them money, but to give them a job. It's better to teach me how to fish than to give me a fish.
Hong Kong people have had to work together to overcome many obstacles in the past. Pressing ahead and embracing future challenges will require a similar spirit. That's Pearl Magazine for this week. Join us again, same time next week. Bye for now.